Healthcare in America is in a crisis. The U.S. healthcare system is confusing and overcomplicated. Due to the strange bureaucratic nature of it, I personally went 5 years without any healthcare. No doctor, no dentist, nothing. The current healthcare system is a strange mix or compromise between the two political aisles. There is very little, but some regulation for the pricing of healthcare services, and as a result, providers intentionally set prices not designed for the individual to pay, but for their insurance.
There are countries, particularly in Europe, where they are not nearly as well off as we are, and everybody gets health care. That's one thing you don't have to worry about in so many other places. And we have gone a long way with the Affordable Health Care Act, and that's done a lot for people. But for America, to have anybody living in America and who is eligible for health care, we need to figure out a way to do it. And I think we can if we would just stop fighting each other and recognize health care as a right, and I think it is, then we would do something about it. It's not as if we don't have the money to do it. It's about the will. Mm-hmm.
The U.S. is one of the only Western countries to not have a fully implemented government option. The Affordable Care Act, despite being thought of as a government-provided option, actually just works to subsidize the insurance and to help lower costs for health care.
Absolutely free market. We need to get government out of healthcare. Government has ruined everything it's ever put its hands in. So if you want to actually fix the healthcare system as a whole, what we're generally talking about is how to pay for it. If you get the federal government out of the way, the individual marketplaces of each state's competing against each other can drive some free market solutions and see what the pitfalls in some states are and what the advantages in other states are, and hopefully, you know, that type of if it's turned over completely to the states, then those types of opportunities can arise for states to create marketplaces, free marketplaces within their individual states that drive solutions that hopefully everybody can adopt.
The problem when it comes to healthcare is that it's an inelastic market, which basically means that even when price goes up, demand is still high. This is because healthcare is always needed, so it's always in demand. This factor is very important. If we were to move to a free market approach, the market would distort prices and some people would not be able to afford the care they need, which would not fix the problems that we're trying to solve in the first place. So if not free market forces, how do we do it?
My instinct, and what I wish it were, at the federal level, I wish it were, because I think that would guarantee everybody access and higher quality.
Moving to a nationalized system could both streamline and do away with the bureaucracy and make it universal to anyone who needed it. Nationalization isn't scary. Time and time again has shown that healthcare is an industry that works when nationalized, and there are many different ways of nationalization anyways.
I think the reform could be a combination, as we are trying to do now, but because we don't have everybody's support, it's not working. I should not have to have money to get health care. I shouldn't have to. And we should not even put that burden on a company for whom I may work, because it's unfair to them as well. But since we do have one part of our system that is commercialized, I wish we had more standards around making sure that's affordable, and then the rest of it could be like with the expanded Health Care Act, the Affordable Care Act. We need to do those two things, put them together in a way that people are actually served without having to go broke or without even being able to afford it if it's something that's going to be a commercial plan.
The answer is simple. Healthcare is simply too important to be left to the market. To have trustworthy and affordable healthcare, we should move towards a universal system.